Hello, thank you for joining me for a virtual presentation of my project. My name is Courtney Bracken, and I have been working on this project with my professor Paul Davidson and two of my colleagues, Ariel Celia and Jason Walker. We are passionate about this topic as nicotine use remains a primary public health threat, and we are interested in seeing how system dynamics can play an important role in this current research. Cigarette smoking is the primary cause of preventable death in the U.S., with the majority of nicotine users establishing their habits during adolescence. This pattern makes it crucial to focus prevention efforts and policies on adolescents. Since the introduction of electronic cigarettes, or e-cigarettes, or ECs, in approximately 2010, they have become extremely popular, with the National Youth Tobacco Survey in 2019 estimating U.S. adolescent electronic cigarette use at approximately 20%. Our current project is a work in process which examines the initiation, progression, and diversification of nicotine products among adolescents of different ages. Unfortunately, long-term data on health outcomes of ECs will not be available for several decades due to the recency of electronic cigarettes. With this project, we aim to use system dynamics modeling to assess conventional cigarette use, or C use, EC use, and hybrid, or H use. Then, we tailored the model to simulate different scenarios such as the presence and absence of electronic cigarettes and mechanisms of self-recruitment and social influence. It's important to understand that the risk factors for EC use almost entirely overlap with those for C use, meaning that EC and C users are highly similar with respect to socioeconomic status, personality, mental health, and family and peer substance use. Now, typically, the conventional approach is to control for these pre-existing factors of covariate adjustment in a regression. However, this often gives biased results in severe cases of confounding, which is definitely the case here. Fortunately, system dynamics modeling has the potential to overcome these limitations through simulation and isolation of certain variables. So, let's discuss a bit about the overall development of our model. The C and EC users were first divided into age groups of 12 through 17 by each year, and then 18 plus. For hybrid users, we made a simplifying assumption that these users reside in a single stock 18 plus. Next, we divided users into 3 stages of substance use severity. These stages were based on cumulative lifetime exposure to C and or ECs. More specifically, Stage 1 users is in regards to, quote, have you ever tried a cigarette or e-cigarette even once? Stage 2 users is a cumulative lifetime exposure of either 100 cigarettes and or 100 days using electronic cigarettes. Lastly, Stage 3 users is approximately equivalent to daily use. For this model, once a user progresses stages, they're unable to move back upwards in the model since the stages represent lifetime exposure, which is, of course, irreversible. Next, we included death rates. Each stock of 18-plus-year-olds had a corresponding outflow due to death rate, and then the total deaths accumulated in separate stocks. On a side note, death rates for those under 18 were assumed to be negligible due to previous literature. Considering that nicotine use has substantial health risks, life expectancy does decrease as the stage of use severity increases. Next, we calibrated the model based on the U.S. Census Bureau 2000 population values. At the bottom of column 2, we can see a small snapshot of a section of the model which exemplifies both the horizontal aging process as well as the vertical progression of severity of use. In the interest of time, we will not dive into the details of each equation for now, but please note that each progression and aging process has a detailed equation corresponding with it that is based on previous literature and data. Moving on to the results. First, we look at the base case scenario, which is steady state cigarette use and no ECs. Since the goal of the model is to test how the introduction of ECs affects nicotine use trends, it's important to first examine this system before the ECs are introduced. As expected, the base model shows 0 EC users and H users throughout the duration of the simulation. Here on the poster in graph number 1, we can see C users 1, 2, and 3 at ages 12, which are represented. During the base case, stocks of C users are positive and show a somewhat steady state behavior characterized by sawtooth pattern oscillations that repeat every year and maintain the same magnitude. The model did present with a similar steady state oscillation pattern for each age group. Next, looking at the stepwise increase in EC use. Since EC use was brought into the model after 10 years of simulation, it resulted in a stepwise increase in EC use, which is seen in the second graph. Then, by introducing ECs, we can see the full effect of both types of nicotine use and how they may merge together in the middle of the model as hybrid users. It is also important to note that once ECs were introduced into the model, the number of individuals in the C stocks were significantly lower. This change in the model is important for current research because it shows that as new nicotine products are available, people may first experiment with a different type of nicotine when normally they would have been using conventional cigarettes. Next, we move into the extreme conditions test. Again, in the interest of time, on the poster, we have just displayed 2 of these extreme conditions testing. First, in graph number 3, we see a scenario where there was no voluntary self-recruitment mechanism, or in other words, this switch was turned off. In graph number 4, we see a situation where there was no word-of-mouth social influence mechanism, again, when that switch was turned off. In both scenarios, graphs 3 and 4, the familiar sawtooth pattern was still present due to the constant recruitment inflow and discrete aging processes. However, the steady state values of stage 1 users were slightly higher than in graph 1, and the values of stage 2 and 3 users were both much lower. Fortunately, these results were sensible because eliminating one of these mechanisms would reduce each of the progression flows. In other age stocks, a similar pattern was also shown. So, what does all of this mean? The main findings that were discussed in this project are consistent with real data, which is promising for the future steps of our project. This work is pertinent to current research and policies regarding adolescent nicotine and tobacco use. As I now wrap it up, I want to thank you for taking the time to listen to my presentation regarding our work. I want to say a huge thank you to Paul, Ariel, and Jason for your guys' help in this project, for your guidance and your expertise. I really couldn't have done it without you guys. And to the audience, thank you again. And if you have any questions, comments, or just want to chat about the work, please reach out to me. I look forward to hearing from you.